hire additional lawyers, or can we necessarily pay for existing positions? That being said, Michelle's done an excellent job in working with the Office of Public Defense. We've been working with Jim, and we found a way to use the money without doing that. For example, the Exxon contract was about 150,000 between the two offices. We paid for out of 10101 funds, so it's not a expense to the county. There was a printer. There is some salary that is essentially grandfathered in. Correct me if I'm wrong, Michelle, from back 10 years ago. So we are moving positions around to fund those and have been since January 1st, 2026. So there is 10101 money that's paying for some salary and benefits. It will continue to do so going forward. So essentially, we're going to try to spend on, obviously, all of the money that they're going to give to us. And at this point, it looks like we're expected to just about do that. There's about $50,000 by my math yesterday that would be left over, but I'm sure we can find some creative way to spend that as well. So we will be continuing to do that. And then if at some point we get to full capacity, we may be able to use that money for additional attorneys.
Okay.
Thank you, everyone.
Thank
Appreciate
you.
it.
And done so far. Okay. Like Jackie.
So next miscellaneous, the 44 million CDBGR that came from the federal government after the fires. We put out an RFQ to get firms who have worked kind of on the national level to help with rehousing some of the people who have still not had their houses put back together post fire. This would be to augment the work of long-term recovery groups separate from. And what you'll see on today's 2 p.m. consent is just accepting the proposals, or even just like 9 proposals, goes an RFQ, accepting the 4 firms that applied, that they are qualified, and we're asking for it to go straight to the 2 o'clock so the grants team can continue moving forward in conversation with them and start having some contract conversations without losing another week of time for them to move the process forward. So you will see eventually, if you approve the 2 o'clock today, they'll start working with these groups, and then you'll be able to, I believe 2 of them are ranked higher than the other 2. I'm not part of that committee, but that's what I was told. They'll work with those 2 groups and you'll see those come forward. So that's just when we asked the fast track to.
So do these firms, do they work on helping households like rebuild, or helping them find temporary housing until?
This is to put up permanent
Okay.
housing. Whether it's, say they have large contracts with modular homes, forced and built, they can go either way. And the 2 firms have scored well. Our goal, one in Southeast, one of hurricane experience coming in after the really large storms and the mass scale putting stuff back together. You'll once they work out contracts, and you'll see at that point, say a year, May, based on what the forwarding there, full proposal.
That's gonna then take us to.
Morning.
Good morning.
Nice to have that. Tanned and relaxed. Let's see how long that lasts. Oh, it's tan. So I have a couple of limited access requests for the board today to consider. First one's Hallett Road on the West Plains, and this is at the Westville Arrow interchange, the Medical Lake interchange. And this is a kind of a remnant of before all the development happened. There's a little section of Hallett Road shown in red there that runs behind the Petro and the couple of commercial businesses. And it's not used. It was essentially abandoned when they realigned Hallett in front of the Petro. And it's become a real nuisance. They get people parking / camping / living there. So they would they've gated it at they made the request and we allowed it, but we would like to formally acknowledge that gating, limited access. If they want to pursue vacating it, we wouldn't be opposed, but for now, just a limited access so they can better control who's back there and what they're doing. Our office definitely supports that. They have to go in and out, clean up afterward, stuff that's been taken. Happy to answer any questions. Okay. The next slide, please. The next one is basically up on the side of Mount Spokane. Laurel Road is the name of the road, a very windy, mountainous, dead-end road. The folks that live along it also get a lot of people trespassing. We don't do a lot of maintenance up there. They've requested the limited access. All the folks within the area that are requesting it. There's nobody that doesn't want it. And again, we would support that request. It's been a challenge for them. They get a lot of people trooping through, wanting to get up into the woods and go hunting and do whatever. It's not good access for those types of activities. There's better access points all around now. Happy to answer any questions. Okay. Next is a traffic code revision. Never had enough of those. And this one is for adding 2 stop signs. And this is up north of Green Bluff. And what it is we have, these roads are getting busier. There's more and more people dividing up property and moving out here, which is difficult for our rural areas. But this has really bad sight distance. When you come up to the intersection, until you were almost out in the intersection, you cannot see. And currently it's not controlled at all. And we've had some close calls. I don't believe there's been bad accidents, but when our traffic engineer, Nate Thompson, went up and drove it, he was like, yeah, this can't stay this way. Because they're 35 mile an hour roads and people come up to them. Anyway, we'd just like to head that off. The 2 stop signs being proposed are on the lower volume roads and just to better control that intersection. Any questions? All right. Done.
Okay. Okay, Erin's online. We're bumping Scott as on a panel this morning, so we're gonna bump Scott Chesney to not before 10:30, so. Then get him when he is available. But in the meantime, we have Erin.
Good morning.
Good morning.
I don't even know how I got this really cool background, but let's enjoy that. Okay.
It looks
And
like.
you're showing the kids?
Yeah, that's what I was thinking.
And you're showing the kids?
Yeah, that's a good one. Yes.
Gotcha.
Hey. All right. Well, I'm here to brief you this morning on the 2026 fair admission and parking prices. Next slide, please. Just another reminder on our super cool concert entertainment lineup. Good buzz out there, hearing from many people that, they'd love to attend all 3. So that makes us feel pretty good about what we've put together, and ticket sales are tracking well. Next slide. Okay, rundown on pricing this year. All prices are the same this year for fair admission, except for the 3 that I've noted, but I'll just run through from the top. Adult tickets at the gate during the fair Monday through Thursday are $15. Adults at the gates Friday through Sunday are $17. Seniors and youth, $12 all days. Military at the gate all days, $12. Children 6 and under, always free. And then we have our adult preseason pricing. So discount tickets now until September 10th. Adult tickets are $11. And then our change this year are our senior, military, and our group rate, which we have increased from $8 to $9. Our group rate program is where you buy 20 or more tickets and you receive the dollar rate. So those are the 3 changes that I'm requesting approval on this afternoon. I did want to highlight, we will have some great promotional days as we always do on Friday, 9/11 is Heroes Day. So first responders will get in free, that and military, veterans, etc. 9/14 is Senior Day. So that's always a popular day. 9/15 will be Sensory Day. And we've programmed a really exceptional day with less sound and lights and making it a unique, positive experience for our guests on Sensory Day. 9/18, we'll be holding a food drive. So there will be a discount available if you bring items for donation to the gate on Friday. It'll be for the first half of the day. More information coming out on that. And then we always wrap up the fair on 9/20 with our Coats for Kids coat drive. Any questions on the admission before I go to the next slide? Okay. Next slide, Ron. The good news is parking prices will remain the same for the 2026 fair. $10 all day per car per entry. And then on Senior Day, we will continue on with our $5 parking fee. I know that's a big hit on that day. People love that. Something new this year, we will be accepting credit cards for parking. Next slide, please. I just wanted to highlight where tickets can be purchased. Always available at the fair office, Monday through Friday, 8 a.m. to or 8:30 a.m. to 4 p.m. Online through Tickets West. Fees will apply. We have a great partnership with Wheatland Bank where we offer our Carnival wristband package, where you get a wristband voucher and an admission to the fair for $40. New this year, we've partnered with Yokes. All the Spokane area Yokes stores are selling a 4-pack of admission tickets for $40. So these discounts are available until September 10th. Next slide, please. Again, requesting that the board approves our 2026 fair admission rates on the 2 o'clock agenda today. Any questions?
Just kind of needing to kind of keep up with costs and all of that.
Yeah, we just have tried to maintain everything and try to keep it affordable and offer a couple of new options that are a great value if you pick up that 4-pack of tickets at Yokes, or promoting out just in general to buy ahead, and you can save in a lot of different ways.
Okay, great. Thank you, Erin.
Thank you. Have a great day.
Okay, you too.
Thanks.
We're just here.
You have a
Well, a short one. I was out last week, but I just want to let you know that 7 Mile Road, that partial closure, this is technically a City of Spokane project that they have a private contractor working on. But calls have been coming in because it's in that area where it's like, is it county, is it city? So I've sent out a couple of news releases about that. You may have some media attention this afternoon about the fair tickets and also the demolition. And I'll be up in the crow's nest, so I'll get downstairs as fast as I can if you have interview requests. So otherwise, things are progressing nicely with wayfinding. We have finally jumped through enough hoops with the companies. The frames are in, and we're hoping that it will be ready for an unveiling in September. Charissa deserves kudos for walking this thing through. It has been a tortured process. So other than that, any questions?
Well, did the fair So I know we're gonna make a decision on air admission, any price changes that we just got the briefing on. Is there something informational that can be provided to the press about that? With all the details of the days when there's discounts?
I can put that together.
I mean, Aaron probably has it. I was just
Yeah.
thinking if you had it, then we could just give it out to folks after we.
I'll make
Make our
sure it's
decision.
up on the dais for
Yeah,
you,
okay.
so.
Cause there's there's a slight increase in a few that's being discussed. But I'm really happy to see all the days that there's discount and the new 4-packs and things you can buy ahead of time that are gonna save people a lot of money. So,
Yeah.
anyway, wanna make sure we get all that information out if there's a
Alright.
question. Now, what demolition were you talking about?
I believe that's something Commissioner Kearns
It's later on the agenda.
Oh,
is
okay.
going to be presenting, but it did receive some mention this morning
Okay,
during the morning news.
oh, related to the fires. Okay.
Yes. So, thank you.
Thank you.
You want me to jump to that?
Yeah, what just.
So, yeah, it is item M on our briefing here. So during the Grays Norgan Road fire, one of the things that we did following that is, we lowered the cost of demolition permits, because following a fire to haul off those things, you're supposed to get a demolition permit. So we reduced the fees down, and so, one of the things that Scott and I had discussed before he went on leave was that trying to find a standard of sort of what would trigger this, and we're thinking, and I don't think this is spelled out in the resolution that this will be an ongoing trigger, but maybe something we discuss is that if a fire receives the FMAG money, which is the fire management assistance grants from the feds, that maybe that would be a triggering mechanism in the future to where we would lower demolition permit. So the resolution that will be in front of us this afternoon at 2 o'clock is to lower the fee down to $27.12, which is the processing fee for it. And then it looks like there's a $6.50 state surcharge application fee that we have to charge. So it would lower it down to whatever those two numbers added together are. So $33.62. So that's.
You know, its current fee is.
I do not, yeah, more than that.
That's the
Yeah,
lowest.
the lowest we can bring it down to.
That makes good sense. Thanks for bringing the idea forward. For future discussion purposes, you know, we could add that if the county declares an emergency, like we did in Gray, that could be, sometimes those may or may not line up, right? The FMAG versus the county declaration, but that could be a future conversation about the standard. And I say, let's move forward today.
Yeah, because we didn't declare an emergency on this one, but there was a federal declaration.
Yeah, we ended up getting federal dollars,
So
yeah.
that's what's driving it.
Yeah, it says the Federal Emergency Management Agency approved the governor's request for the FMAG support. And so,
So, no.
Thank you.
We have city staff.
Okay, is Doug's not here. I mean, Chris and I could go next too, and get ours out of the way.
I did text Preston, you might want to come,
Oh, okay. So we'll hold off.
and sheriff.
Okay.
I'm not sure about the sheriff. I texted them both just to see if they wanted to come. I heard back from Preston that he will try.
Okay, and then George was ready.
They're coming over right now. They're in here, they just need to come in.
Okay, when
Yeah, they're right there.
Good morning.
Good morning.
Congratulations on a timely meeting.
Yeah, much timelier than normal, so yes.
So Brittany's here today to talk a little bit more about the home electrification appliance rebate program, or known as HERE. This is a program through the Department of Commerce. And so Brittany will tell you anything more about it.
Right, so just kind of a quick recap, this, like George said, this is a commerce program. We did have it this last go around, and I'll kind of get into a little bit more details about that in a minute. And so today I'm kind of just updating you. We did apply in February for another round of this funding. And we're kind of seeking your approval today to accept an award that we received from Commerce after that application, as well as entering into contract negotiations with both Commerce and with SNAP as our subrecipient for those funds. So quickly, just looking at the prior contract outcomes, this is this last contract that's already been spent down for a while now. Roughly 108 households served, 3 multifamily housing projects served, 2 businesses assisted. And that kind of just did a little breakdown by zip code if you are curious. It's a little hard to do it by district, so I just wanted to get some information out there for you. But happy to provide more if you want to reach out to me, and we will talk further about those previous outcomes. So then the next slide. So this is looking at the new award and contract. So as I said, we applied in February. They were a little delayed on getting back to us with awards, but they did. We got a $630,000 award. So the period of performance is kind of unknown at the moment. Working into contract negotiations, I'll have more information on that. Originally, it was supposed to start in April, but because of all the delayed announcements and things like that, that's not going to be the case. So just kind of looking at the general budget breakdown, you got a 15% admin cap on this funding. So we're looking at that $94,500. Spokane County will take a small portion of that. SNAP will take the majority as our subrecipient because they had to do the majority of the funding. And then looking at that equipment and installation cost down below. So then the scope of work, just kind of overall what the program expects is to provide rebates and incentives for the purchase or installation of permanent or semi-permanent high-efficiency electric equipment with a focus on low and moderate income households, renters, nonprofit organizations, and small businesses. These can serve adult family homes. Our contract cannot, as you have to specifically outline that when you apply. We did get 1 or 2 that inquired about it last year, but just not enough to kind of go through the administrative extras that we would need to in our contract for this year. And then the next slide. Looking forward, after we are able to enter into contract with Commerce, we would have our subrecipient SNAP. They did last year's contract as well for us, and it was great. Went really well. They have a great outreach in the community, as you know, and a lot of people have been used to working with them, and they have other, programs that have similar qualifications, so it's really easy for them to get people through the program quickly and get those rebates and incentives out to the community. So very similar agreement to what they had before, a little less funding this round, so just kind of smaller numbers there that you see on the screen with their admin and the equipment, but still happy to get anything out to the community that we can. So just little tiny program updates that they have, nothing crazy. Like I think last year they did allow refrigerators with some exceptions, and this year they don't, and just kind of some smaller things to try to target more low income individuals in certain census tracts and things like that. But again, nothing significant worth going into too much detail about. Again, their period of performance is to be determined right now. With us not knowing ours, we can't really tell SNAP what theirs is quite yet, but we'll work on that as we go through the negotiations. And then next steps, please go to the next slide. So looking into the next couple months, after we get the submitted work plan to Commerce and enter into those negotiations with a few little language tweaks and things like that, hoping to get most of that done in July and then bring a resolution to you all to accept the award and authorize a DocuSign of the contract. They specifically go through DocuSign, so I know it's a little bit different than how we normally do our contracts. So looking to bring that to you hopefully this month, if not early August. And then I'll also be working on a few administrative things like tribal consultation letters that we have to do for the program, as well as executing and drafting that contract with SNAP, hopefully in August. That's my goal, but we know how things go, so we'll see how that turns out, and then looking at getting the program started as soon as we can. I know there's a lot of people waiting on these assistance that SNAP provides, and so just trying to get things moving as quickly as possible. And that's all I really have for you today. If there's any questions, I'm happy to answer them.
So when I think about a program like that, there's certain ways that an individual I think would be able to utilize. So whether they're on natural gas, shifting to electricity. They have a existing electrical or electricity powered unit or device that is not high efficiency. Maybe an individual has an appliance that goes out, maybe breaks. Are any of those prioritized above the others when individuals are being chosen for this program?
Yeah, generally speaking, they're prioritizing those transfers from fossil fuels to electric.
Okay.
It's not to say there's plenty of people that were served this last round that did have just electric inefficient and then upgrading from there. So there's still plenty of people served with that, but Congress does have a bit more of a priority this round on that transfer.
Okay.
So we'll kind of work out the nitty-gritty of those details and how exactly that prioritization works, but that's mainly through SNAP's program. And kind of their intake process. So if you'd like to discuss more, I can kind of figure that out with SNAP and bring some stuff back to you.
That's great. I appreciate it. Thank you.
Great. Oh, thank you.
Thank y'all.
Okay, next up, we have our friends from the city of Spokane. They're going to join us. We have Amanda and Dawn here. Chris McKinney is our homeless programs manager. And they're just going to give you the presentation that was provided to the Spokane City Council as well as the Spokane Regional Continuum of Care. So this is the results from our point in time count. Commissioner Kearns, I'm always mindful of you and the time between when the data becomes available and when you all hear it. So we're happy to have Amanda and Dawn here to share these results with you all. So,
Thanks, George. So very first thing, anytime we talk about the pig count, I'd always say a big thank you to all of the partners, all of the volunteers that helped make it possible. We really couldn't do it without them. It is a county-wide, community-wide effort. With the point in time count, there are two populations that we look at every year. We look at the unsheltered count, those who spent the night in a place not meant for habitation, a car, a park, an abandoned building, and then those who spent the night in a shelter. So that is emergency shelter, that includes all of our year-round beds, any of the inclement weather, the scattered sites, as well as any emergency declaration beds, as well as transitional housing. The pig count this year was on January 27th, 2026. Slide. When we look at the pit as well, there are major population groups that we break down into. One of them being adult and child. So it's an adult with someone under the age of 18. Everyone in the household is over the age of 18, adults only. Child only is everyone in the household is under the age of 18. You have parenting youth. So those 18 to 24 with children or under the age of 18 also with children. You have unaccompanied youth. So they're under the age of 18 or 18 to 24 by themselves. No one's in the household. And then we also have the veteran groups as well. And the chronically homeless. So those that have been homeless for at least 12 months or 4 times within a 4 times within a 12-month period. Next slide. Okay. As I mentioned, it was January 27th, 2026. This year we had 1,738 individuals and 1,500 households. The majority of the population were adults only, so we had 1,419 individuals. We had 92 households with children and just 17 child-only households. Now, all of these were sheltered. None of the kiddos were unsheltered. Next slide, please. Okay. Now, looking at a further breakdown, when we focus on sheltered, we had 855 individuals in shelter and 240 of them in transitional housing, right? And transitional housing is a program that has intensive case management. It's 1 to 2 years with pre-identified units out in the community. In shelter, we had 183 unoccupied beds and 56 unoccupied beds in transitional housing. Now, zooming in onto the unsheltered count, that was 643. I will take a moment to point out that we had 121 individuals that reported being in their vehicles. Vehicular homelessness is obviously sometimes not as visible as other types, so it's worth pointing that out as well. And then we had 70 individuals that were in encampments. Next slide, please. As I mentioned, we have parenting youth categories, right? So that's a child with a child. We had 9 parenting youth with 9 kiddos. And then we had 136 unaccompanied youth. 17 of those were under the age of 18, but all of them were in shelter. We had 119 of them that were between the ages of 18 and 24. Now, when we look at our chronically homeless, we had about 590 across the board. The number between Mercy Shelter and unsheltered and chronically homeless is pretty close, and it was very similar last year too, so we have a fairly even distribution between the two. We had 640 individuals report serious mental illness, and 404 of them report substance use disorder. We did have 139 survivors of domestic violence. Now, in the vet count, similar to several years now, we have a decrease in the number of veterans that we are seeing in the point in time count. There's a continued positive trend. For the first time, though, in 2 years, we did have a veteran household of adults and children, but they were sheltered. They were not unsheltered. Next slide, please. Now, when we look at the demographics, similar to when we present the LSA or when we look at any other demographic breakdown, it's fairly similar in the sense that the majority of the individuals are white, male, and between the ages of 25 and 54. That remains the primary demographic breakdown. The second bar underneath is a breakdown of those that selected Hispanic. If they selected something else, what additional race that they selected. Next slide, please. Now, when we look at the historical trends, we're seeing about a 4% decrease this year compared to last year. It's a pretty consistent downward trend, which is encouraging because that means it's sustainable, right? We would be concerned if it was an incredibly short drop. As I mentioned, this is for the entirety of the county. And as we can see this year, we had a pretty good distribution. I mean, the last couple of years, we've done a lot of work to make sure it's not just in the primary urban and suburban core of the county, but throughout. We had several surveys as far north as Deer Park, and then we had some further down in Cheney and in Ouray Heights. So this is a positive trend that is continuing. That sort of call out bubble that you see is all of the surveys that happened during the Spokane Connect event. So they were all localized downtown in that convention center. And we pulled that out so that you could see that those were specifically done at the time of the Connect. Next slide, please. Now, as we're zooming in a bit more here, we see the distribution more in the urban and suburban core of the county. Again, this year we see several out in the valley, which is good. That means we have partnerships and are able to count in different areas throughout the valley, so we're not missing that population. Next slide, please. Okay. Now, HUD has specific questions that you're required to ask. Locally, you can always choose to ask additional, and the PIC committee this year did choose to ask 2 additional questions. One of them being if the individuals had a photo ID or a social security card. And we can see that the majority actually don't have either a photo ID or a social security card. The next question that we asked was if they were from Spokane County before experiencing this episode of homelessness. And actually, this was the first year that we asked it in both the sheltered and unsheltered, because in prior years, it had only been something that we'd ask in the unsheltered count. Next slide, please. So when we look at those that said they were from Spokane County before experiencing homelessness, in both the sheltered and unsheltered, that's over 75% of the individuals said that they were from Spokane County. And then if they said that they were from outside of Washington, there was a subsequent question to ask if they were from Idaho. And then the 35 respondents that said that they, I think it might be actually 28. No. Okay. That said that they were from Idaho, most of them were from Northern Idaho. And then on the next slide, we'll see the trend that continues in the unsheltered, which is that the vast majority, so over 75%, continue to say that they were from Spokane before experiencing this episode of homelessness. And we had almost a 90% response rate on this question. So we're very, very high certainty on this number. Next slide, please.
Can you repeat that one more time? The 90% was responsiveness on what group?
Responsiveness for unsheltered, yes.
Thank you.
Yeah. Next slide, please. Now, when we look at the takeaways, it's really important to remember that this was a snapshot one day in January, 6-7 months ago, right? The BIPOC individuals, although they don't, like we said, the majority are white, male between the ages of 25 and 54. When we do look at the BIPOC populations, they are overrepresented when we compare that to our census data. The document check question did let us know that there is room for improvement and strengthening our document readiness for those that are experiencing literal homelessness. And we do have some availability to increase the utilization of emergency shelter beds, as well as continue to expand those upstream housing solutions like homelessness prevention, which are incredibly successful in diverting people from entering the system. And across the point in time count, the LSA, the system performance measures, we are seeing continued trends of improvement, which is good. That consistency is important. We do still know that there is room and areas that we can continue to grow, but we are seeing improvement across the board in several different measures. Okay, that's it.
So can you speak to what you mean by document readiness support? So like being there when people are trying to get folks housed with important information, or what do you mean?
It's why they added the social security and photo ID question to the point in time count.
Got it,
here,
okay.
Because folks can't get housed without those two documents.
Got it.
So that question was asked specifically to try and identify how ready are folks to actually be able to engage in housing? Because even if they're ready personally, no property manager can provide a lease without those two documents.
Got it.
So I identified a real gap in folks' document readiness by way of the identification required for a lease. Or even a temporary housing opportunity.
And then I like these takeaways, thank you, that's helpful, it's
Yeah.
like, okay, 5 takeaways. So the utilization of the emergency shelter beds, is that a trend? So 200 beds were unused during this period that you were counting. And there could be lots of factors, but is that something that you see each year? That there's hundreds of beds that aren't being used? That seems like a large number.
No, I think it was a little bit larger this year. A decent number of those beds were in our youth and young adult shelter, which has pretty low utilization continuously. Although their last month actually was up.
Yeah.
They were close to like 75% for June, which was a great thing. They've averaged as low as 35% some months in terms of utilization. So that's part of it, is trying to get that youth and young adult population to really access. That's the 18 to 24-year-old shelter that VOA operates over by the community college. Crosswalk, which is the under 18, has a better ongoing utilization rate. And I think part of it too is we had a warmer winter. And so typically when we count in January, it's quite cold, people are more motivated potentially to access a shelter bed. We had much warmer temps this year, and so we saw even our inclement weather beds, we would activate them, but they were also utilized less than years prior. And we think the temperatures just did not stay very low for very long this winter. And folks may have been able to be outdoors where they prefer to be without the same consequences. But one of the things that we want to kind of look into, track more closely this year as we watch that utilization rate to figure out, is this a system problem? Is it a connection problem? Kind of what's the barrier for folks to be able to.
Can I ask, and I know these are not your definitions, these are the federal definition, but why do they classify 18 is adult, but then you go down and then they have sort of 18 to 24 can classify as youth in some, why don't they just put straight, if it's 18 you're adult, under 18, it's youth. I mean, that seems like that gives sort of a gray area on
It-
some of the calculations.
It does, and it used to be different. Several years ago, HUD launched the Youth Demonstration Homelessness Program. Spokane's one of a handful of communities that receives that grant. And it was really intended to try and pilot some best practices where we know that 18-year-olds are typically pretty resistant in some place like House of Charity. It feels very unsafe, there's a massive age gap. If they're 18 and their average population is 54. And your length of homelessness usually looks quite different in those age gaps. And so really trying to create a space where people who had not been on the streets a long time and were younger had an opportunity to focus with peers and more quickly exit the system, and a space with services more designed to their unique needs compared to kind of lumping them in with the really adult population. And it was a safety issue too, especially for young women who might be 20 and on the street. And it's a little bit unique. Not every community has that. And also at the state level in Washington, we are unique to have a state level Office of Youth Homelessness. That also has done some specific carve outs for that age group, who historically, to your point, Commissioner, was once you turned 18, you were strictly an adult. And it created a lot of exposure challenges that they're trying to mitigate against by creating more protected spaces. And an 18-year-old could still go access an event at UGM or HOC because they are technically also an adult.
Okay.
We can see them in both places still.
Okay. And then, can I ask, how many supplemental questions did you ask that were local not federally required questions? Oh, two. Okay, because I know in years past, I think there's been like 20 or so questions that have been asked previous years. So
Yeah, this year it was just the document readiness that
just the two, okay.
and the where you from question.
Okay.
Really because we see that the longer those questions get, the fewer people want to engage with us.
Yeah.
It's a pretty invasive experience anyway, and it's kind of, I think not to speak for Amanda, but data wise, like we have data on all these individuals in HMIS because they're engaging in projects. So it's kind of an additional point of tell us about yourselves.
Yeah.
And the more questions we've added in the past, the less people are willing to complete the survey. They might answer the first 4 or 5 questions and then they don't want to do anymore. So we were trying to keep folks more engaged, to try and get better data quality of the questions we were asking, instead of mediocre data quality with more questions.
Yeah, because I remember years ago, there was a question, I think it was worded something, it was, where was your last, like, I think it was asking like for an address or like an exact location of where was your last permanent address before becoming homeless? And that broke it down actually to where the city, so we were able to see, okay, the individual is homeless now. They were from, they're from Washington, they're from Spokane County, but where within Spokane County, whether it was at City of Spokane, Valley, unincorporated county, Liberty Lake, Airway Heights, like you're actually able to, with that question, find, where was your last permanent address?
Yeah, I think it was a zip code that we asked folks to identify, and I think part of the.
It was evictions. So that's when, that one specifically narrowed it down into evictions. So I do remember the chart that you were talking about, where were you evicted from? Yeah, where were you evicted from? So Matt Anderson with Eastern Washington University, I think it was 2022.
It was
Yeah,
22 or 3, it was a fantastic, it was the models, the way you were able to click and graphs would adjust, I mean, that was a stellar presentation here. I remember it.
Yeah, so that one was specifically on eviction, and that Matt Anderson's team, Dr. Anderson's team at the university, they did a lot of research with those zip codes, and then they overlaid county eviction data on top of it, and they went by neighborhoods. It was incredibly impressive.
Yeah.
We did publish another study this year with Matt Anderson's team as well, for 2025, and we're working on the 2026 one. I feel like that's a shameless plug to go look at that report, but it was a lot of work was done by the students at the universities.
It'd be cool if you could just email it to us, and then we don't have to go look for it.
That we can do.
Sure. I will give it to Chris.
We do.
Yeah.
That we can do, yeah, it's a good, and the university's helping that every year.
Oh, okay, I just one last question about like trends. You have some trend data into the back to 2019. Are you seeing any other trends, I guess, around the substance use, specifically people who report that they have substance use disorder or mental health challenges? Have you looking at past years, is that changed at all? The percentage of folks that have been, that are sheltered and unsheltered?
I would defer that question until the 2026 report from the universities comes out, because that is something we want them to dig in to a little bit more. And they do more in-depth statistical analysis than just like the percentage that responded. So they do more like, you're 3 times more likely to have reported this if you were in this or that. Similar to what they did in last year when they said, if you were surveyed in like the downtown core of Spokane, it was 2 times more likely to have been from Spokane County than from outside of the county. So
they have a good breakdown in the report from last year on the likeliness of self-reporting some of those indicators. The one thing I would say too is self-report is about as what I allegedly like eyewitness testimony. It's like it's not a super reliable statistic in our minds in terms of how we design services. I would presume it's probably underreported in the point in time count. And honestly, because people are just being asked, do you think you have a problem? Which is very different than what somebody else might think to be true of somebody's current state. But the report they did for the 25 and they're working on for the 26 does dive way deeper into that than what we submit to HUD in terms of just raw report.
Yeah, I was just wondering if some of the opioid investments that have been made by the city and the county, and then the beds that we have at STARS that didn't exist in 2023 or 2024 for folks who need to detox and enter treatment. I was just wondering if that's made an impact at all, but it's probably hard. You really have to dig into the data.
Yeah, a lot of it's identified, so it's hard to, but we probably have other data sources that would more accurately tell those trends and the point in time count and things like that, and share some stuff with George and Chris to pass along.
Well, thank you for
Thank
that
you.
and giving us information today. Hi, good morning.
We have 2 items to brief on this morning. And the first item is on our RCO Nova Trails program grant, and I'm going to turn it right over to Jonathan Smith here to speak to us.
Thank you, Doug. So you all might remember that in 24, we applied for and received grant funding for a utility study out at the Airway Heights Park. So we are here to give you a briefing on that and then seek some support in our next steps. We've been very successful with the NOVA program. In 28, we received funding from RCO for this program to develop a master plan for the ORV park. And then in 22, we received additional funding to do phase 1 of that master plan. That was $540,000. And now that brings us to this grant that I'm here to discuss. In 24, we received grant funding for the utility study that we are pursuing now. In putting together that grant, we sought information from different consultants to provide estimates on what a utility study would cost. Then when we received the grant funding, we went out and asked for proposals from county civil on-call roster. We realized, oh, well, this is not enough money to do this amount of work that we have in our scope. So I reduced the scope. I sent it back out to the consultants. They said, still not enough money. It's a little frustrating. So I went to RCO and they informed me, well, for this specific program, we don't provide any grant increases after it's awarded. So they recommended that we close the grant agreement and just reapply in 2026. I asked them, will this have any effect on our ability to get grant funding in the future? He said, no, this does happen. So just this is what we recommend. There's a caveat there, and I'll get to that in a second. But I did want to tell you that at this point in the grant agreement in this project, we haven't requested any money from RCO for this grant, and they haven't dispersed any money, so we're at a place where we really are at a balance. And the utility study is necessary for implementing next steps in the development of RV park. And the caveat in this is that a couple days ago, I received an email that vaguely, from our grant manager that said, I told you that there's no additional funding for this program, but there might be actually additional funding for this program. So now we're here to tell you, hey, we might want to close this grant agreement. We want to get support for that, but at the same time, we might have some extra funding coming in. And we had already, uploaded this. We had already scheduled this briefing, so we thought we'll just tell you all the facts that we know and seek your support for closing the grant agreement, or if we get more funding, then forget that we were ever here. We'll just go yeah, with that, we just seek your support in those steps. And
Is there additional slides?
I'm sorry, there's one additional slide, the next slide there. If you provide our support, we'll work with the grants department to provide a formal letter to close the grant agreement. If we do receive additional funding, well, then we'll be back before you to discuss this when we have a successfully executed grant agreement.
So will they, if they do additional funding, will they just amend this grant agreement, or is it a separate grant agreement?
I really wish I could tell you that I have not been able to get a hold of our grant manager. I imagine it as our grant agreement. I don't think we need to do a new agreement. But I'm a little bit guessing because I haven't gotten any guidance from RCO, so except for a cryptic email. So
It'd be great if they want to provide additional funding.
Yeah, I agree. And if they don't, we do feel confident that if we reapply for the correct amount, based on what we've learned, that we would be very competitive in receiving what we need. So one way or another, we'll stick with it. And hope to accomplish it.
Any questions?
Yeah.
And the second item, we've received quite a bit of input, I guess, the last couple of weeks and under the park system, where Scott Simmons asked that I come and provide an update to you just on how the level of service, our level of service is being received out in the field this year. And we are different than last year. So I thought I would start here just with kind of an update of where we're at and what our park services season and adjustments look like. And we're starting with the positive and the best right at the top there in bold. In 2025, we had an 18-week service season. And with your support, we were funded additional dollars that allowed us, we were looking at a 16-week season for 26, and instead, with your support, we're able to extend and increase from 18 up to 20 weeks this year. So we do have an extended season, which we're very appreciative of. And that has already been, I think, helpful out in the field. But we have, in combination with that, though, there are several strategies that we've employed to work within the budget. And we have, those include a reduction in the number of cans that we're able to provide out in each park, and the frequency of collection. I think Kurt and team have tried to target weekends, Friday, Saturday, Sunday, Monday, as much as possible as the busiest days, and then it gets stretched during the week. And so that has been implemented, and I think he's been able to absolutely meet what we've lined out there. Frequency of restroom cleanings has been reduced, and we have definitely had some feedback there. And again, a restroom cleaning can last 20 minutes, it can last 3 days. It really depends on the patron who used it last. And so we've had some very specific feedback on that, some incidences. The potable water drinking fountains, we have those at Liberty Lake and Plants Ferry only. There's been a fair amount of savings in time by not activating those, so we're asking folks to bring their own water outside of those areas. We have the portable picnic tables have been left in storage this year. That helps greatly improve efficiency of mowing, and the thought is it may reduce some of the trash generated. So where the tables aren't bolted down, we've not placed those out. The shelter rentals were limited to Bear Lake and Liberty Lake. And then we have electricity within certain shelters. We've not activated those. Those require quite a bit of maintenance to keep them live. And then the irrigation curtain team have tried to reduce that a little bit more. So that's what we lined out to accomplish as kind of those minimums. Next slide, please. And we have again a schedule that's out there. There's just a summary of the last several years. So I'm very pleased to increase the service season. Next slide, please. And in response to a fair amount of input from the community, we have worked in coordination with our communications team to update our website to improve visibility of the service reductions that are out there. We've also issued a park alert that makes it much easier to find. So if you were to visit our home website for the Parks Department, there's a note there front and center where it's really easy to follow the link. And again, up there on the right side is the information that we're trying to provide, or that we've provided. The green in this case are links to learn more. The one will take you to the chart. Some other challenges that are contributing, we have some unanticipated FTE vacancies. You may recall, as part of the plan budget, we eliminated one of the project manager positions, was scheduled to be eliminated halfway through the year. They left 3 months in, which was very helpful to using those savings to help provide the care for the dog park that we took back on. But we did not expect to lose our project manager, landscape architect 2. So that individual left for an outside opportunity, and our park ranger retired on us with very little notice. So those folks are very helpful in whether it be with website and responding to inquiries, signage, that sort of thing. And the park ranger, of course, and I'll hand out I put together a summary of a lot of the input we're getting. So we are in communications with the Sheriff's Department. In fact, we have another meeting tomorrow. We put both of those vacancies on hold pending the 2027 budget so that we can look at a long-term solution. We've already done some consolidations, and we will look forward to visiting with you as part of the 27 budget process for how we'll look to manage that in the year ahead. And we have tried to make a point of tracking the inquiries this year as they come into the admin office. So I have a summary of that. We've had sometimes it's phone calls. We've had some email traffic. I've included one copy of an email correspondence from a concerned citizen that you'll see. They were not aware of the service reductions, but they managed to list virtually every single one. And then to round that out, we had a really nice compliment. We do receive compliments, and so there's a nice email from a community member that has just had a very positive experience out in one of our conservation future sites and has seen our staff out there and appreciates the work that's being done, and it's very visible as well. And so I'm going to hand this out, and there's a summary. And then that said, Kurt and team have also received quite a few calls at the operations division, and his folks are on the field. So I thought he might kind of speak to just what he's seeing out there as it might relate to the summary of the comments.
Yes, we tend to get most of our comments in the field as citizens see our working, and they're a little more upfront, if you will, or honest as compared to a phone call or an inquiry. Again, we get a few comments, compliments, I should say, but the comments are very similar to what you're reading. You know, what happened to our drinking fountains, or there's a mess in our restroom. Why is this restroom locked? Trash cans are overflowing. What happened to the trash cans? We do our best to respond and or address the issue or the complaint at the time. In the best way we can. I think the summary sheet pretty much explains what we're hearing as a department wide. Just in the field, it's the delivery is a little different, maybe less tactful.
So at the beginning of the season, I know we put out information about the parks, they're opening. Did we communicate about the service reductions? Clearly, maybe we
No.
missed that.
No, we did not call attention to the service reductions. We certainly provided a link where folks could find their way, but we did not call attention to the service reductions.
We need to lead with that, but I mean, the positive news is the longer season, but
Yeah.
maybe having that information at least around, I know I would wanna know if I need to bring water or different things, just, you know, it's hard for what everybody has.
Yes, and we're trying very hard to do that in a factual way. Just in an informative way. So ultimately, I mean, the bottom line is the team really is doing a good job out there. If you're familiar with these, they are delivering, and I spend a fair amount of time out in the parks, and for what they're doing, they're doing it well. And I think it can be challenging for the staff. As Kurt said, some of the direct feedback in the field is more sometimes direct and suggest that the staff isn't doing their job and what they should be doing, and we do our best to explain, no, that really we are. And if you look out there, they look pretty darn good for the work that's being done, other than these areas where we know we're not delivering the way that we have. The parks look pretty good. And I think in some ways been really surprised to see just how frequently a lot of the picnic shelters are being used, even though there are not picnic tables under a lot of them. People are bringing their tables, they're having their gatherings, and Kurt's team is utilizing the efficiencies to be able to go more parks with fewer people in a fewer amount of time. So, but at any rate, we wanted to relay just what we're experiencing and the pros, the cons, and we're looking forward to 2027, and maybe things will look a little different next year.
I want to look at this as a positive. How many people do you think have visited our park so far this year?
Oh, gosh, over a million. pushing 2 million.
and 27 people have complained. That's pretty damn good. I think we got a pretty good parks department, if you ask me. Over 1 million people have visited parks and only 27 complaints. That is a fraction of people that had an unpleasant experience. So I think things are going pretty well.
Very good. Well, I want to go out on that note. That's great. And again, they really are working hard. We feel pretty good about what we're doing out there. Very good, I think, about what's being delivered out there. And yeah, if they get to it. It may not be as quick as we would like, but we're getting there. They're getting there.
Just a quick question, is it possible, and you're the operations guru? When people were saying, well, there's just a couple garbage, is it, since you're going to the one spot to empty 2 garbage cans, is it possible to put more? Or is it just, does that just draw more? Is that just not operationally possible?
The reason for the reduction of quantity was we can get around the facility faster, so we're visiting the sites less. And when you visit them less, there's more garbage, obviously. So if it's consolidated, the idea was if it's consolidated in fewer locations, we're only visiting fewer locations and we can skedaddle to the next park in order to make our rounds across the county in the working day. There have been properties though that we've went back and added additionals because it was just overwhelming. Some of the water sites are in fact overwhelming and continue to be. Those are our hot spots. We visit those 4 or 5 times a week, but we have adjusted on the fly as needed. We've got a couple of locations, yes.
Thanks for all you do. Appreciate it.
Welcome.
Thank you. She appreciated all you're doing, and yeah, I agree. It's like, you know, if it was, we'd have more complaints. So I mean,
most folks are understanding and go for that. Thanks very much. Great. Yeah, thank you very much.
I don't know if you've got a thing yet. It was gonna be 10:30, but I just was seeing if you.
Yeah, Preston's caught up in a meeting, so couldn't make it. So I'm happy to just kind of give an update. Want to just keep the board informed as to some of the conversations that are happening with the safety health and planning team and facility meeting. Do we want to talk about EPF committee at all? Or it's not on the agenda for today to vote on those individuals, so we could say that for next week, or
No, we can still look at it.
sure. Mike Sparber was tasked to reach out to the owner's rep regarding the architect position. So Mike, do you have any update on that? Just checking in.
Yep, I just talked to him. He's got one more clearance that he's got to do, but he said he's in. So it looks like he'll be able to fulfill that role for us.
Okay, great. And then the other seat was real estate. Did you have a thought on that? You want to?
Yeah, so I think you talked to Emily with Downtown Partnership. Some thoughts were someone from Cole's family. You know, because they've got real estate outside the area as well as in downtown. And otherwise,
She had given us some kind of construction names too.
yeah,
One was Walker Construction, one was Fountain.
this is. Yeah. So we're still investigating those and. Knowing that some people from downtown were not happy wanting it downtown, but. it's like
I
we've
was just
gotta look-
thinking, do we want to appoint individuals who have a bias against the current location and?
There's pros and cons to it. those, sometimes it lets them know that there's not other locations.
Education.
Yes. So I think that's a lot. So I'm gonna be reaching out today to Betsy Coles to see if there's somebody she would like to, or someone else that she would like to get on there, because I think with them having property outside, but they're gonna know kind of the area, but they also will know that they're one person on the committee to understand why, what the purpose is and all of that. So
The other thing to just share on the EPF committee is, I was at the planning team meeting, I think it was Friday last week. That'd be right, Chrissy?
yes.
I heard from GSI, DSP and Waters Meet that the board decided not to include a kind of lived experience or system user perspective, and they continue to suggest that that be done as a good trust building measure. So just, I was asked to pass that along because it continues to be something the group feels
I
is
may have
good.
a resolution. So Mike, with MacArthur, there was discussions that we needed to, there's public outreach that goes along with the EPF committee. Is that correct?
Yeah, there, and there's heavily, I mean, the process heavily informs the community about what's going on, and there's reoccurring meetings along with a website that we've set up for it. So
So is there a way for us to have a couple of people kind of head up maybe one of those public comment sessions to help with that? So maybe I know as they wanted someone with lived experience, I think it's to me, it's like there's a balance between lived experience and people on the other side of that, as we know from courts. And so we can talk about that later, but you know, having two people and then have maybe been on a team co-host one of the public sessions.
okay, yeah, we can certainly talk around that, and I see that Jim's in the room too, so that's something we can definitely try to put together. And I know that Clarissa's going to also be involved, so we'll look for those opportunities, commissioners, to maybe have some of that.
Because I think if we did something like that and specifically task those two people with getting the public comment, I think that could provide a better public comment if they got their groups to attend and provide comment to what the committee's doing. So that's my compromise, is coming up with a way to get them to be part of the, help lead one of the public comment areas.
Yeah, I think that we could definitely do something with that, and then we can talk with to see who we want to bring forward as, you know, to participate in those meetings. So we'll come up with something.
Thank you. Yeah, let's talk later.
Okay, you got it.
Thank you.
Further updates, at the last facilities work group meeting, Mr. Brooks and I kind of passed along to this group of elected officials the funding options presentation that Jeff and team gave us, I think last week, right? I'm losing track of all time at this point. So just kind of laid out what those potential, you know, the current and potential new revenue streams are. That was well received, so thanks to the budget team for putting that together. I think has been kind of a surprise to the group that the 2/10 possibility is significantly smaller than it was a couple of years ago. I just think people haven't necessarily seen that number laid out clearly. And so that's one thing that's been happening, is just kind of a dialogue around what those options are. Based on our past conversation and Commissioner Brooks and Commissioner Waldrop visiting San Antonio, right? There's been increasing conversation about, okay, if there was to be a phasing of safe and healthy investments, what would be a potential phase one investment on the facility side? So this idea of an intake and assessment center has been talked about in the past week or two. It could do a lot of things. I could let either of you flesh that out more, but it could be like a larger Sally port and processing area. It could have some courtroom space for like a magistrate type hearing. It could have some medical services space beyond what we have now, which is very limited, some mental health beds. It could provide a kind of immediate connection to services for those kind of coming to the jail, and it could be kind of built to grow for the future as well. So that's been talked about kind of in concept. The initial feedback is very positive and lots of people interested in exploring that further. So at the next facilities group meeting next week, the idea is to really dive into that in more detail. It is important to really flesh out what that looks like operationally, what's required to staff it, how do people get kind of directed through the different doors, so to speak, of like, oh, this is a person who just needs to go right to jail versus this is someone who could be kind of connected with a judge right now, given a release plan, connected with services. So that is important because even San Antonio's had some challenges around bottlenecks in their new intake center.
We still have that book and release center.
It's different.
Is
right,
there,
it's
is there any
different
way
than
that could be incorporated in along these lines?
I mean, because this is similar to what happened in Montgomery County, but it's just what we were trying to do was much smaller, because we had limited dollars. And so I think it's using that and playing upon it. I don't think we could use that because you don't have a whole Sally port. I mean, part of the problem is to do it right, you gotta have a really good Sally port that brings everybody in. You've got enough room. I mean, our booking facility just is not big enough. And
I just wasn't
truly-
sure if there's a way we could
'Cause you still-
utilize that.
You'd still bring everybody in through that center.
Okay.
There has been some discussion, the city's been very interested in that question as like an interim step, right? Even if we were going to build a new expanded booking area, that would take the time.
And
Is there a way to?
because it's
do
not
something?
connected, but we did pay to have like it's a fully enclosed fenced off walkway from one to the other, but I don't know.
It has been raised as a question, and the city especially has been wondering what could be done in the interim. So we could talk about that in the facilities group too. The next meeting is really to dive into, okay, what could a intake center really look like operationally, and how could that really help the system flow more efficiently, but also the critical piece that I've talked with Judge Hazel about is making sure to the maximum extent possible that when anybody is leaving the jail, whether it's for reentry or release, that they've got a strong plan, that the courts have weighed in on that there's a strong connection with service providers, if that's part of their release plan, that they're not just being kind of let go into the street, so to speak, but it's being kind of connected to the maximum extent we can. That's very important for a variety of reasons, including to the business community here. So that's been kind of an emerging theme of discussion, has been kind of the idea of phasing, and is the intake center a viable option for phase one. Carter Globally will be looking at that specifically. So that will be one of the options that they provide us.
Tasking that one. So let me see what Sparber has to say. Sparber?
Yeah, just to follow up, I had a long conversation yesterday with Carter Global Lead, and we talked about the Bexar County, San Antonio's model. So they're familiar with it. They also have a model that they're looking at out of Houston and one other one that I can't recall right now. So in that report, it will include the things that you asked Commissioner Brooks and Jordan on that particular area. And as far as the intake and release center that we have right now, the challenge is staffing. We would only be able to staff it like we did before, which is during the day hours. So we certainly need to flesh the idea out, but it was a real challenge last time coming up with the staffing they would need for 24 hours. And so happy to have those conversations with the facility group.
When I think that's fine, when we look at scale of a bigger intake center, it actually is, it's surprising that it's much less staffing than you think, where I think our scale here on a smaller one is probably about the same amount of staffing as what a bigger center takes. So,
Yeah.
it's
And additionally, they could be doing other duties, Commissioner Brooks. You see what I'm saying? So a bigger booking model, and I apologize, Chris, I'm looking through my files for the one that we had last time. I think it's in the iterations, but let me go back through it and I'll send you guys a revised copy of that part of it. But it makes more sense rather than having it bifurcated like it is right now, to have it in one area, and then those staff can also be utilized for other duties in the meanwhile.
So I just asked Mike to kind of go back through the past iterations and designs that have been done to see if there's any lessons or previous designs that could be pulled out to inform on the discussion now, because all of those had dollar amounts tied to them too. And then I think, Mike, is Carter Globally, part of what they'll do is to try to give us a rough understanding of cost. Is that correct?
Yeah, they'll give us a rough order of magnitude of what, in today's cost. And they too have all those iterations, commissioners, to evaluate, and all of them various dollars throughout the years, how much they cost. But really what they're looking for, and what I really focused them on yesterday, was this concept of it being more of a triage center. When they're coming in and they're trying to determine, is there an opportunity to change the trajectory and have them head off for, either diversion or for treatment for mental health or behavioral issues that go along with that. And then the concepts that they have is that infirmary that has MAP programs that are attached to it. So there's a lot of good benefits around what they're exploring. So yes, the short answer is they're going to give us some scenarios based on today's dollars on what it looks like.
So a couple other things that came out of the last planning team meeting. I think it was a really positive meeting. I think everyone's, I can't say everybody, but my sense is there's a strong feeling among many of the stakeholders to continue driving towards progress and action coming out of the task force report. So there's a couple kind of subgroups that have broken off to meet in the next week and a half, reporting back to the planning team next Friday on the coordinating council. So Preston's kind of leaning into that, taking the lead and drafting ideas for what that could look like. There was a group that I think Mike and perhaps the sheriff are going to be involved in around high utilizers. And then there was another one kind of around data sharing. And so those are kind of early candidates that if we could develop some initiatives that we could expand what's already being done in those areas, or kind of reformat the SRLJC, that will be, obviously those are decisions that come back to the board, but it's trying to be vetted through this interjurisdictional group to see if there can be some level of consensus developed beforehand. And then the other idea that came out of the last one was to see if we could designate a communications point person from the city, valley, and county to be in touch if there's a need for coordinated communication around task force issues going forward. So those are a few updates from the last meeting. We have another planning team next week. So those groups will then come back and say, here's what we came up with on a coordinating council idea. What do people think? Is this ready to come for a larger public conversation? A couple other ideas, and I can just keep, there's a lot of moving pieces, but yeah.
So you touched on, you shared the different revenue streams that are out there, and there was that discussion with the group. The 210s that you talked about, folks were surprised at what the value of 210s is now compared to what it was a couple years ago. I mean, that's the one that has a deadline here on if we're going to move on that this year. Is there discussion around that? Is sort of consensus of the group that will be a future year rather than this year now?
My assessment is it's still a discussion with nothing ruled out yet.
Okay.
That's my assessment.
Just
Yeah, I
it's
think.
it's the
I think-
14th of
I
July.
know, nobody wants to say it's over, till it's
Okay.
over. But also, I mean, I think people are, I mean, I think we've got to have the discussion. Yeah, are we gonna go for the 2/10, or are we gonna go for a levy lid lift, you know, and actually get enough money to do what we need to do? But we kind of, I mean, the problem is we don't know kind of the cost of things yet. I know in San Antonio, when they built it, they started construction in 2016. It was opened in 2018, their intake facility. It was 32 million. So I'm assuming double that at this point in time because of cost since then. But that's a lot less expensive than a $300 million facility. You know, so until we get more information, I mean, I think we're just, you know, we're trying to get there, but we don't have all the information we need to make that decision yet. So we're seeing if we can get that information as quickly as possible. And we can always do a special meeting if we need to.
A couple more things just to put on the radar for thoughts is, to your point, Commissioner Brooks, about the public engagement piece. That was a big theme also from the last planning team meeting, is that seems likely to me there's gonna need to be a ballot measure to fund, to make the safe and healthy plan successful. I think the question is when and what does that look like? So regardless of when, the idea of having some listening sessions, opportunity for the public to, in a broader sense than just those kind of super involved people who've been at the task force table, to weigh in on some of the priorities, was an idea that's continued to be well received. So that's one. And Mike talked about the ability to unify the MacArthur funded community outreach we're already doing with this safe and healthy effort. And so Gwen, as I talked about before, is our consultant on that. She's very happy to help. So the group was very positive on trying to not just duplicate and have kind of public engagement over here and safe and healthy over here, but try to bring those things together. So that was one theme.
And I feel like the EPF process
Yeah.
as well. I mean, to me, it's all one and the same. And so how do we combine it so we're not, because as we know, it's not always easy to get public engagement. And so if the more that we combine to try to make that all happen and have all discussions at once with people, and I think, you know, kind of have that the lived experience and the victim side, you know, be the ones leading, you know, or helping get people there, I think could be a positive thing.
The other idea that's come up is, one of the recommendations from the task force was to encourage the jurisdictions to look at current funding streams as part of an evaluation of what dollars could be brought to bear. So there's a possibility of maybe having our budget teams get together, or having some outside analyst come in and look at the options. So opioid dollars just being an example of that. We know, for just as an illustrative example, that we had allocated some funds to the health district that are no longer needed for the MAT expansion. Could funds like that be used to stand up some efforts in the interim, perhaps pilot projects that are coming out of the recommendations as we continue to work on the bigger picture plan? So that's a lot I've just thrown at you, but I just want to make sure to share information.
Sure. Just discussions, not anything that we're set on. Again, I keep reiterating that the county is kind of the bookends. People come into our facility and they leave our facility, they go back to their cities. And so we've got to have the cities be thinking about how they're looking at it, that it's just not the county that can provide all this funding.
You've mentioned several times, it's, you know, if we were to do a ballot measure, the dollars that the county receives would go to the facilities, then we're gonna need interlocal agreements with the cities if they want to fund, you know, the services, the programming within the facility. And that would probably benefit us more to have those types of agreements in place before a ballot measure passes, rather than trying to get them after. So, yeah.
I mean, I mean, we don't want to say we're not gonna have it, put it on the ballot in November, but we also, I think the reality, we're all coming down to the reality that there's just no way to do it. But can we do it in a manner that if we don't put something on the ballot in November, that then we're committing to putting something on the ballot? You know, because we can't do it again until next August.
Correct.
Maybe the next
I
time.
think August and November are the only two
Yes.
that you can't, right?
Yeah.
Is that right?
But then, you know, if we do that, we've got to be able to show the community and the public that we're doing things in the meantime to engage and getting that positive feedback out there, communication out there to show these steps that we're continuing to do as to why we need to have people support that ballot measure.
Yeah, we've
Because we
made-
don't want to put it on the ballot in November and have it fail, because we don't have everything quite planned. But I think we're getting a path, you know, and you know, being able to say, these are the things that we do need to have happen. And then positive things are happening. I mean, path will open before then, you know, just things that we can show that, you know, we are investing, we are making a difference, but we still need something to happen, you know.
There's just a real sense of momentum, I think, in the group right now. So regardless of timing of ballot measures, I think there's a real prospect of injustice related activities. And I'll give an example. If maybe we could give some thought to designating a kind of communications point person. I don't know if that's kind of our central or is it kind of a department, you know, like the sheriff's office or something like that, but the city put out a press release last week on the expansion of their behavioral response unit within the fire department, which is funded by the county. And that's an example. That's an example. I forgot that part.
They didn't mention
Well, it was mentioned that it was funded by the county, but it was low in the press release.
Little
And
asterisk,
so
yeah.
my point is though, that if we had a group, you know, if we had a designated person to say, hey, but if we're going to share information about a safety and health investment that's kind of in line with this topic, let's be in touch about how to do that together. And then if, you know, as PATH rolls out, there could be a shared strategy there. Or if some initiatives roll out of these subgroups, we could announce that and communicate it in a more coordinated fashion.
I mean, Mark Lou is our only person at this point in time. So,
Been sitting back here
yes.
waiting.
So I
Very
would
good.
say, stay aware of Martha Lou and we'll stay in touch.
Certainly.
That's gonna be a good idea, because
They've asked for Martha, I can respond and say Martha Lou's been designated.
Yes,
Okay, very good.
she'll be the contact person.
Yes.
And if she needs help, she can talk to the, I mean, because this is where, if you need help with that, Martha, you could talk to the prosecutor's office or the sheriff's office and see if they can help you with that as well. So,
I know both of their PIOs very well, so.
yes. That'll be great. Okay, I know Scott Chesney's on, so Scott, let's get to you. Scott.
Oh, there we go.
There you go.
Good morning. Thank you for your flexibility on timing today. What we're asking for your guidance on is there's a potential grant, or there is a grant being offered by Commerce for up to $75,000 to help jurisdictions improve their permitting process. There's a total pool of $475,000. It's a competitive grant. There are a lot of places interested in this, so it may be an award somewhat less than that. But the award is very flexible. It can be used for improved software. It can be used for training. A lot of opportunities or sort of unrestricted opportunities that would help us improve our permitting process. And so what
Scott, you just muted yourself.
Scott, if you can hear us, I think you clicked the mute button.
You got the
But
sense of it.
Yes.
They are hoping to.
Unmute. Okay, I'm sorry. Thank you. Anyway, what we're looking for is there's an application date of July 31st, and we're simply looking for a consensus that we should go ahead and apply for this and see if we can use this to help our permitting improvement process.
Anything we can do to improve it, it would be greatly appreciated.
That's kind of what we thought, but we certainly wanted to touch base with you. And by the way, there's also no matching funds or no other obligation on the county's part to go forward. So if that's the case, we will prepare an application and we will get this started.
Can you please check in with Heather in the grants office so they're aware of everything also?
Of course.
Thank you.
Of course. We'll do that and we'll get that started today. Thank you for your time. And again, thanks for your flexibility.
Okay, thank you.
Madam Chair, one, I guess miscellaneous now. On the last topic, Preston just texted me. He said, feel free to indicate I'm committed to the success of the task force and hope to engage as much as possible to accomplish the mission. So that's from Preston. I just want to thank him and the sheriff and Commissioner Brooks for all the great engagement.
Yeah, I think it's important. You know, Preston's committed. I think the sheriff's committed. We all know we still need things, a new booking facility, like, you know, at a minimum. So, great. Okay, any other miscellaneous items?
Quite a few executive sessions.
Okay, let's go.
4 executive session items today and 1 closed for labor. First is pending and potential litigation under Article 42.31.101. Approximately 30 minutes, again, no action. Jeff McMorris, Matt Folsom, Devin Curda, Kyle Tuig, Mike Sparger, Michael Hazel, Louis Grader, and Jasper Coulter. The second 20 minutes, no action, pending and potential litigation under the same RCW. Jeff McMorris, Matt Folsom, Devin Curda, Kyle Tuig, Ben Bradabo, Harper, Eric Messenger. The final 2 are pretty short, 5 minutes, no action, pending and potential litigation. Jeff McMorris, Matt Folsom, Devin Curda, Jasper Coulter, Matt Zerakor. Then pending and potential litigation, 5 minutes, no action. Jeff McMorris, Matt Folsom, Devin Curda, Wes Dickow, Heather Arnold. No action. 1 hour total.
Okay, and closed session, should we do that this afternoon?
Chair for closed session this afternoon.
That's probably our reality.
I'd prefer this afternoon.
Okay, since
I have a hard stop from the 12 o'clock to 2.
You're not allowed to do hard stops.
So something going on.
He says jokingly.
Al, you just said.
Just under miscellaneous matters, Jeff McMorris, acting CEO appointment to the Public Development Authority. Did you guys discuss that before I got here, or?
Yes.
We did, we're good.
Okay, and so what did we decide?
We decided to have Kyle Tuig represent the county at both the Northeast and the West Plains.
Well, one thing I didn't bring up, I wasn't here yet, Al did ask for me to stay on S3R3.
Oh, we didn't say that.
You did the same?
Yes.
I was waiting for him to.
I asked, I said,
Yeah.
was there discussion about who fills in on S3R3? And you didn't say anything. Because all I knew about was NEPDA, which you're good with NEPDA?
No problem.
Okay.
Yeah, and I'd much rather prefer, the nature of the conversations are different. I'd much rather prefer to have Jeff there than Kyle. Not that I don't like Kyle. You know, I know his family, going back to his grandmother, but just the nature of the conversations and because of who's sitting at the table from the city side, I think Jeff would be much more effective.
Okay, I mean, it's just temporary.
Correct.
So we need to make sure the resolution reflects that.
The resolution actually doesn't have names in it. the resolution says it can, the CEO or acting CEO can appoint based on board approval.
Okay, but for approval with me. Awesome.
Jim just left with me.
I would say let's just try to have the names of the resolution, it was just a temporary resolution,
Okay,
so. That way it's just clear.
yes, it is temporary.
And if, just for the sake of flexibility, if it said, you know, the acting CEO and or his designee, it gives a little bit of flexibility in case, you know,
That could be the better way to put it.
yeah.
I think that's how it's drafted.
It's
To
drafted.
provide the flexibility.
Okay.
How long are the, or how often are the meetings for STRs? Monthly?
Monthly for the board meetings, and then activity wise, much more active than that.
Okay. I was just thinking about his time, that's all.
It's from 7:30 to 8:30 in the morning, so there's,
8:30, so, and we provide breakfast.
There you
So,
go. Gotta
yeah.
eat anyway, so.
doesn't conflict.
Okay.
Okay. Okay. Very good, then, we'll go into executive session for purposes as stated, a total of an hour, which will get us out right at noon. So let's go. No action will be taken, so at the end of that these executive sessions, we will adjourn for the morning and see everybody back for the 2 o'clock, and then there will be a closed session at the 2 o'clock, after the 2 o'clock.
General.